All right, thank you for staying with Daybreak. Listen, you were just in time for that conversation that we were talking about. It's the missing HIV drugs, not because they're not there, but they're stuck at the port. We'll find out why they're stuck there and the impact this has had on the persons living with HIV and AIDS. We'd also like to hear your questions or comments on any issue in regards to HIV and AIDS. We'll have it answered here at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. Let me introduce my guest real quick, beginning from my right. Dr. Samuel Kinyanjui is the Country Director, AIDS Health Foundation. Thank you so much for making time. Also, Patricia Acero is here, an HIV advocate. Thank you so much for making time. And Bernard Baridi, National HIV Youth Prevention Ambassador. Thank you so much for making time as well. Dr. Sam, I'll start with you. What is the issue here? What are we missing?
Thank you very much for this opportunity, because this is a tough time for persons who live with HIV and the people we work with. The key question here is that the stocks in the counties and in the clinics are running really low. We barely have enough to last for 1 month, and therefore at this point in time the patients are getting drugs for about a week, causing them to frequently visit health facilities and risk COVID infection. That is a big challenge that we are facing right now. And there are no answers coming from the health departments, because each time we ask what's happening to the usual flow, then the only question we are told, okay, we'll sort out this matter in the next coming week. And I think this has been the story for almost 2 months now. And I think it's a critical time right now so that the hard answers are answered and the patients get clarity on the continuation of their treatment.
So generally, how many weeks are they supposed to get? But when you say that they're getting medication only for a week, usually how long do they get medication for?
Stable patients are supposed to get medication for 3 months so that they can continue doing their normal duties. And especially now that we have the COVID pandemic, we want them to come to the facilities as infrequently as possible. So the 1 week or 2 weeks is completely unacceptable.
Yeah.
Yes.
But what is the government saying? What is the issue here? Why is there a delay?
The stories from most of the government officers, they say, oh, this matter is beyond my capacity to answer.
Okay.
It is at PS or CS levels, level to action.
Yeah.
And as a result, as partners, we also wrote, and civil society, we also wrote to Mutahi Kagwe asking for him to respond to this issue. I think Baridi will have a copy of the letter, or if it's not shared, it can be shared. But Mutahi Kagwe has not responded. Okay. All we know is that there are drugs stuck in the pot. And why are they stuck at the pot? Because the government is demanding, I think, 92 million as taxes. And it baffles everyone. We get donation because we are not able to meet the needs of our people. And then we introduce barriers, taxes as barriers, risking the lives of more than 1.5 million Kenyans. We are, as a country, we've been doing extremely well because most of the patients who have HIV infection know their status. And they've been diligent coming for care, and as a result, they remain healthy and productive. Now we risk to jeopardize all these gains. We are seeing the number of children, mothers who are pregnant mothers who are infecting their children is on the rise. Is it really ethical to allow a mother to transmit HIV virus to the child because we want taxes? The key question for me is, how much tax would we collect from donated products? To what extent will that contribute to the development of this country? Vis-a-vis the lives that we can lose, we stand to lose by stalling these drugs at the port. Yeah. Those are the key questions.
Okay. Baridi, what has the impact been for this lack of medication as a youth ambassador?
There's a big problem with this thing of medication, all because as Dr. Ria say about the government and everything, it started with April, not only now ARVs, it started with April, where we made a lot of noise last year, where it was pushing people living with HIV to go deep into their pocket to start buying Septril because there was an issue. Now, the impact that I can say, because if you're given drugs of 3 months, you're supposed to come to the facility after 3 months. Now, the problem I'm having, the young people that are in school were given drugs for one month. And remember, some of them coming from Nairobi, going to different schools in the village and the rural areas, and then they come back. Some of these young people are born with HIV, and they stay with their cousins and relatives. Now, to get even the transport to go to Homa Bay school, then come back every month was a difficult thing. So we started looking at how some of them now missing appointments. Now, if you miss appointment, they don't take a medication, which means now their viral load will come very low. And now you start getting some opportunity infections. Now, if you talk to these young people, some will tell you that I take my drugs today, tomorrow I skip, then I take another day. Even right now, these young people that are doing exams, KCSE does not have even medication, some of them. And you cannot release them from school to come back home because they were given only drug for 1 month. So this is the problem that we're having right now as a country. Young people already struggle and say that we cannot get drugs even for 2 months. You can only get for 1 month. Now it's only 2 weeks. So this is to tell you that the transport of coming back each and every time, the money that you're supposed to do the other things are now going for medication. And then some young people that also live with their guardians the guardian does not even know that they are HIV positive. So also disclosure is a problem. You have seen in the village. Like right now, some of the students will be remaining in the village because of the lockdown. How will they get their drugs at the same time? The other problem is now the drugs were supposed to give them the packet of 3 months. Now they remove the packet and now distribute in different so that everybody can get it. That one also will allow the quantity of the medication, even the expiring date. These drugs, some of them are the same color. Yeah. So you don't know even which regime are you taking. So this one also is going to put us now, we reach where the drugs can be resistant to someone's body. Yeah.
The distribution channel, enlighten me on this. So how does it usually work? If you are a HIV patient, do you pick it from a specific place every time? Or if I'm in Nairobi, and I go to Kisumu, can I not pick it in Kisumu?
So what happens, you have your clinic where you go and take your medication, that they look at everything in your body, especially like you're going to the hospital for the general checkup, but also they give you medication. Now the problem, if you are in Kisumu, last time they used to give people even drug for 6 months. During lockdown. Now the facilities are in Kisumu are running out of stock. The facilities in Mombasa are running out of stock. So even it's difficult for the facility to give outsider the medication that the government put last time, that you can only get drugs for 2 weeks if you are not from that facility. Now if the facility who have medication are also their patients are lacking the medication. So it's also difficult for them to distribute drugs for the other people, the patients. So they'll even give them for 1 week, but that is not enough for the people that live with HIV, especially the adolescents and young people. So that is why we need a really advocacy, because we have written to the ministry. I've talked to all of these people. I've talked to the ministry, I've talked to PEFA, I've talked to everybody about these drugs. I've gone to ministry, I've talked to higher level of Ministry of Health, I've talked to PEFA County Director, Dr. Daniel Tamu. The problem here also that if you talk to the partners, they tell you that they don't have faith, trust with KEMSA. So they say that the drugs, if they can distribute them alone, it's better for them than take it to KEMSA. And that's now you see now the taxpayer is coming in. Yeah. That's why we need, even if it's not KEMSA, and the problem that we're having, even if we go to KEMSA is the only place that can channel drugs and distribute it well. Why can't the government have another procurement company? Or why can't the government clean up the KEMSA so that we can have trust about them? Because once the KEMSA is good, then I think we'll never have such a problem again. Yeah.
Patricia, from your assessment, what is the missing gap here? What is the missing link?
One thing, as a person using ARVs, I want to feel secure to know that we have enough stocks in the country. And on that basis, the leadership of people living with HIV we are part of went out of its way to talk to the head of NASCOP and find out exactly where the gaps were before we came out to talk about it publicly and see where we would be able maybe to bridge it. And some of the questions we had, she was not able to answer. And based on that, the PWA leadership and the civil society wrote a letter to Mutahi Kagwe on the 5th of March. We wanted to have a meeting with him or people from his office and PEPFA to find out exactly what is happening, because we had heard about the medication that is lying at the port. So We've not had any answer to that letter that we sent out on the 5th. Nobody has responded to it. No one from the ministry, no one from Mutahi Kagwe's offices. So we are languishing there. We don't know what to do. And as a leadership, we know the gains that have been made. First, when people are taking antiretroviral medication, that is prevention. So because if I'm virally suppressed, if I have a partner who is not HIV positive, then the possibility of infecting my partner is almost zero if I'm completely suppressed. And that will only happen if I'm taking my antiretroviral medication. Yeah. Secondly, when I'm healthy, I'm able to be productive, to give to my family and to the country. And this time during COVID, when I'm taking my medication well, that means my immunity is competent. Even when I'm putting on my mask, I'm washing my hands, I'm not scared. But when there's fear that the possibility of getting my antiretroviral medication is not there, we are in a panic, all of us. Because we know that in the country, we need to have 9 months of antiretroviral medication at any given time. That is the batch that is supposed to be at KEMSA. But as we are speaking, we've been told that we only have 1.5 months. Because initially we used to have a drug that is called TLE. Yeah. Okay, that is a combination of 3 pills that has efavirenz. But then now we've been transitioned to TLD. So that one is a combination that has dolutegravir. So the transition has happened and most of us are on TLD. So what is missing there is the TLD that we are all on. Yeah. It's a drug that is working miracles. People's viral load have been suppressed. We are feeling better than it was before. Yeah. But now, where we are, this is the drug that we are getting for 1 month. We have a strategy in the country that says that it's called differentiated service delivery. Yeah. So in this strategy, when people are okay, you only go to the facility to pick your medication. There are 4 different types of strategies. One, we have the multi-month scripting that Baridi is talking about, where you can be given 3 months or 6 months, given the stock or the facility, so that you only see the clinician twice a year. There is the other aspect where you can form a group, community ART group, whereby if you're 12, it's only one of you who goes to the facility and picks for all of you. So you don't have to be there, all of you. So this person picks the medication, brings it out in the community, and gives to her team. So this one also reduces on transport, it reduces on the burden for the doctors, and it also offloads the facilities. So that you can go to work and come pick your medication from Baridi in the evening. It doesn't have to interfere with your work. But right now, you have to go to the facility every other month. Then as Baridi has said, initially we used to have these drugs in a packet, in bottles for 1 month. Then they were changed. We complained, but still they changed them to a bottle that has 3 months of medication. So now they have to open the bottle and give you so that you are having 1 month each so that you don't miss. But then you don't know whether you are taking your drug. You don't know the dates of manufacturing, of the dates of expiry. Those drugs are supposed to be kept in a certain situation so that they don't absorb moisture. So now you are not doing that. And then the strategy that we have is no longer working. This is something that we had to convince our people, because initially, due to fear and the infection that we were getting, people really love to go to the facility to be seen by the clinician every time. But then now we've gone out of that culture. People are feeling comfortable. People are okay to get their medication at home. Then we are having problems with adherence. People are not adhering to their medication. And that is something that we've been working on. People, they have a problem already. If you ask Daktari, there's a problem with retention. People are not coming back to the facility. But then when we started having the multi-month scripting, it became more easier. So we are losing the gains that we made. And the government is not answering our questions why we don't have our 9 months. And yet I know there are people in the ministry who have been employed to do that. They've been employed to do the forecasting. So if they're employed to do the forecasting, apart from PEPFAR, where is the Global Fund money that usually 85% of that money goes to procurement? And we should not be having this if the people who are doing forecasting did their job well. We are asking what is happening. Where are our ARVs? Why are they rationing them? That I'm getting a month's dose. I went to the facility the other day. I take my medication from Mata. I was given for 2 months. That was in February. And I said, what is happening? That you see, Patricia, we are having a problem with the stocks. We cannot give you for 3 months the way we do because we need everybody to get them. But I say, I don't need to be coming to Mata every now and then. You've gone to Mata, you've seen the way the screening is being done. Yeah. They're looking for COVID. So my immunity is compromised already. I have the fear of COVID. I'm telling you, I have the fear of COVID. Apart from living with HIV, I also live with NCD. I have high blood pressure, I have heart condition. You've heard what the president is saying. So Chacha people, you need to work from home, meaning you don't need to go to the facility or any other place. I don't need to ride in matatus because the matatu guys are not listening to everybody. If it's the Nissan, they are carrying 14 people. So I'm exposing myself going into a matatu. I'm exposing myself going into the facility every now and then. Yeah. So why is this being done? Is somebody out there to make sure that we get infected with COVID so that we can have high numbers? What is happening? Okay. And where are ARVs? Why are those stocks down? Okay. Somebody needs to be able to answer our questions. And why isn't Mutahi Kagwe talking to us? I think he's a public servant and he needs to talk to us. Okay. Yeah.
Dr. Kinyanjui, I can hear the passion in Patricia's conversation on this issue. What is this way forward? What are you recommending in terms of the channels of distribution and even to the Ministry of Health? Has this ever happened before? Is this the first time?
I think I cannot remember a time when we had this level of crisis where the whole country was facing stockouts. And Patricia is quite right, and I like the passion in her voice because it's not just a passion, it is a cry. That she's not talking about somebody else, she's talking about herself, her experience, her colleagues. That's why. What she's talking about is that the responsibility of ensuring that the people in Kenya, the clients as we like to call them, who are taking this medication, have the medication is not the responsibility of a donor. It is the responsibility of government, the government of Kenya. And we have support from PEPFAR. We also have support through Global Fund, but also the country itself has taxes which can be channeled towards ensuring that we have adequate supplies. So while we are clamoring only on this stock that is at the port from PEPFAR, we should be renegotiating this where the patients are still using drugs that either have been bought with taxes from this country or money from Global Fund. So she's very clear and she's very right that we have a clear supply chain. And the supply chain, just like is maintained in your local supermarket. You've never walked in and they did not have your preferred brand of a drink or of food. It's because they have very clear indicators they track and making sure that they keep certain levels of stock so that the clients do not miss. I strongly believe that our teams that are doing the quantification and tracking, inventory management, I think they are doing their work. The challenge is making sure that procurement is done at the right time. And I believe that's where the issues are. I have heard from the government that, I'm quoting this one from the government because they have already mentioned about it, that they need about 450 billion a year to buy ARVs for all the Kenyans who need them. I think this is affordable and the government can afford. Interestingly, out of these 450, I think if the taxes account for about 30%, maybe you only need 300 billion. If we can waive taxes. It is interesting that the government on one side is taxing another ministry. It is strange. So my recommendation on this one, my proposal would be, first, I do not see a business or a commercial case for continuing to tax donations, especially of essential commodities such as medications, such as PPEs. It would surprise you that PPEs, even when we are fighting this pandemic, the taxation is as high as 60%. And as a result, that's why even there have been shortage. And this is interesting because this is only happening in Kenya. We have our project runs in several other countries in Africa, and this is only happening, especially in East Africa, this is only happening in Kenya. This is the only place where we tax donation and we tax essential things as PPEs. You buy those gowns, you buy the mask, all of them are taxed. Even the N95 that's only being used in the hospital is also being taxed. So we should do away with those taxation that are a barrier to service delivery.
Yeah.
That is a clear thing that we need to do. I understand there is a waiver system that doesn't work. So there is no point in putting a waiver system that doesn't work. It's do away with it because I do not believe there's economic value for the people of Kenya. The next thing is that for now, urgently, we just need to leave the boardroom issues to be handled by the technocrats at the Ministry of Health and the PEPFAR level. Get the drugs out from the port. I believe the drugs that are in the port are not in the custody of US government, in the custody of Kenya. And I believe all it requires is a letter to tell the officers who are holding the drug to release them. If the government and the PEPFAR cannot agree on KEMSA distributing the drug because of the issues that have happened at KEMSA, very unfortunate issues, there are other mechanisms. They can bring the drug centrally, and counties themselves have a responsibility of service delivery. They can collect the drugs and get them to the county level. In addition, there are partners who are implementing partners who are on the ground, who are able and ready to get these drugs to the people who need them. Okay. So the first and foremost thing is that we need to get those drugs out today. Yeah. The next thing is that they should be put in a centralized location, and the distribution point can be left at the responsibilities of counties and implementing partner in the meantime. Finally, to solve this problem and to ensure it doesn't happen in future, we need to do away with those taxes that really do not serve the interests of wananchi. Yeah. I believe the government is the government by the people and for the people. Yeah. And if the people are here, people have been on social media, people have been used any means possible. And maybe the people are very annoyed, they may want to visit Mutahi Kagwe. The issue is here. The people are saying, we do not see the benefit of this tax. Do away with it. Yeah. And the other thing we are saying, we are represented at various levels. Where are our MCAs at this hour when the people are facing all these challenges? Where are our members of parliament who make these rules, who approve these taxes? Yeah. Where are they now when the people are faced by this major problem that cannot be sorted out at their level? That's why we have leaders. We have leaders so that they can voice, they can articulate for us at levels where we cannot be able to go to. Yeah. This is the time they need to stand up to be counted.
But medically speaking, Daktari, what will be the impact of this delay should it go ahead longer?
That's a tough one. It is tough because the implication, besides the financial one, because besides what Patricia and Baridi have talked about, that is very expensive for them to keep going to the facility now and then, it is inconveniencing. They lose time that they're supposed to work and money. At the medical level, the implications are very dire. One is that she's talked about retention. What happens is that each time there's a shortage like this one, 70%, about 30% of people who are previously adherents to treatment lose the interest and are not able to continue on treatment. So what happens? Out of this, there's very high level of developing the virus becoming drug resistance. This will require that they be moved from the first line to the second line. The difference between the two lines of treatment, regimens of treatment, is not only, it is about 2.5 times more expensive to put a person on the second line. The other thing, the drugs on the second line have more side effects and are less effective. It will surprise you. And then after that, if they were to move from that level and go to the rescue, that is even more expensive. It can be up to 5 times more expensive. Many more side effects, even further, more poorer in being effective. So the first line is our best bet. Yeah. So the consequences are dire. You are going to see more people getting to advanced HIV disease and more deaths. Yeah. You are going to see higher transmission, like Patricia has already clearly explained, that when somebody is virally suppressed, is is safer in the society. It cuts down our HIV transmission.
Yeah.
So it is unthinkable that we can let this to happen.
Okay.
Yes.
And Baridi, you know, I'm seeing here that the consignment of medication has been lying at the port since January 18th, after state handed a 90 million shillings tax bill to a privately owned American firm called Chemonix, which had imported the drugs on behalf of US aid. Would you recommend that this waiver be done despite their seemingly having an issue with the procedure followed? Because that is where the issue is.
Yes, the waiver needs to be done right now, as soon as possible, because as Dr. has said, if you're in Nairobi and you get that people are getting drug for 2 months, like right now, 1 month now, if you are in this, I've worked yesterday, I worked to around 5 facilities in Nairobi, even the private and the public. I can tell you if they are telling you they get drugs for 1 month, some are telling you 2 weeks. Now, this is now we are going to have a problem because the Cascos, even the counties called me 2 weeks ago and asked me, Baridi, our drugs may back for only 2 months. What do we do? What is the next way? Please push this for us. Now, if the Nairobi is the capital city can have medication for 2 weeks, now tell me what is going on in the counties. So if these people will not be able to waive this tax that they have at the port right now, then I think as a country, you're going to lose a lot, especially for the people who are taking treatment. Like, Trevor, young people who are living with HIV in this country are having sexual intercourse also. They're also human beings. These drugs is acting as a prevention method for us, for them to not to infect any other person, like Patricia said. If right now we sit here in a country where the young people, which we are struggling because they're the ones who are failing on the treatment, when you look at the viral load suppression and the percentage that we have in the country, the ones who really fail right now are young people, especially the 24 years and below, and even the ones who are in campuses. Reason why? Because the side effects were there, but no side effect right now. The stigma that comes around, you know, they don't stay around, they don't stay together. They have to go, they hostel, they stay with different people. They are at school, they stay with different teachers and the students, and now they keep their drugs, medication at school and those boxes. Getting a permission every month or 2 weeks from school to go and get medication also starts raising an alarm in the school and also from the learning institution, where people ask why this person always go outside most of the time to look for medication. Last time it was only that 3 months that you can come to school and even give it to patron where I can keep for you the drugs, then you just come in the evening and take them without nobody knowing what is going on. Now you have to go outside every time to look for this medication. The other thing, we already struggle retaining them into care because the stigma that comes in the hospital, they feel cool and they don't want to go to the health facility most of the time. Now you want to keep this young person now to come, because even now that 3 months for that young person to come to the facility, you have struggled calling them, doing tracing, how have you been, they can even miss, they come, instead of they coming March 15th, they'll even come March around 20th or 27th. So you have to look for them. Now, right now, if you give them that you'll be coming to pick medication for only 2 weeks, what are you telling them? Now, you give them that option that they can now have an excuse that there's no medication in the country, nobody cares about us, and they have the stigma, and they don't have even, most of the things that we need to give these people is the hope to live. Now, if the government, because I've talked to PEFA, if the government cannot waive this medication by this week, then I'm telling you, we are going to have a demonstration in the county, but starting from Monday, which I've already planned myself, we are going to have different counties demonstration, physical demonstration in those health facilities, and ask government to do whatever they can do. If they don't do that, then we'll have another option of making sure that we push them hard, because now it's really bad when now we are really struggling and yet we have medication that we can have in the country and we don't have it. The other thing that government need to do, 70% or 80%, like Patricia said, that from Global Fund goes to this for the procurement. Where is those medication? Where is that money? Where is that money going to? Who takes that money? If PEFA bring the drugs, now, if they want PEFA to bring donation drugs and they want to tax them, now, how do you tax the donation? So if they can't waive it, then which means that there's a lot of problem that need to do, because this one is between PEFA ambassador, a US ambassador, and Mutai Kagwe, which is our CS. So they have to sit down, because every meeting that we have, we think that the people can sort this information. But they are not, we have written letters, we have talked to them, even they will see on Twitter, nobody answering. The last thing to give also the government to look at that, we want the government to pay, to start procuring medication from their own pocket. So if they have money to give even to MCAs for the trucks, why can't they get money to pay and to buy drugs, so that the percentage that pay for using to buy drugs can go to the community services to fight for stigma, discrimination, give CBOs money there to implement, also to boost the economy of the counties, because once you start organization in those CBOs and give people money, give people jobs and everything, will also boost the economy. We want the government to be very, very keen and start looking how can they start looking for money to buy medication for the country. Yeah.
Patricia, what do you recommend going forward?
Trevor, I've had my lawyer friends saying that the Constitution is very clear, that laws are very clear. Our lives are assured under the Constitution. I'm told that Article 43 says that we have the right to the highest attainable standard of health. And for people living with HIV, that means access, unbreakable access, affordability of antiretroviral medication. So we are only asking for what is assured to us under the Constitution, that we have the right to life, we have the right to health, and we have the right to dignity. Because as Dr. has just told you the ice bit of that. I know you are young. Maybe if I talk about the year 2000, I don't know which class you are in. So those days I worked at the Baghdad District Hospital. So that is why it was called. You should have seen patients coming in. There were no ARVs. One person, 10 family members. They're either having diarrhea, they are vomiting, they have rash, which means the person is sick, and 10 members of that family cannot do anything else. They're taking care of this person. You can only imagine that. I don't want to see that. Okay. That is why I'm passionate. Some people say, you are so emotional. It's not about emotions. It's about what I saw. Coming from Luo Nyanza, every weekend in those years, I cannot tell you the number of coffins that were heading towards that direction. And what was recorded was 700 deaths. The unrecorded, I wouldn't know. But it was recorded 700 deaths per day at that time. But even now, HIV is still killing more than COVID. We know that we have more than 25 people dying every day of HIV-related complications. So even as we give attention to COVID, we should not forget what is really the problem, that is HIV. That our focus should not just be swayed. Yes, we have a focus for COVID, but people are still dying from HIV. Why are we losing the gains that we made? Trevor, we went on the street when we heard that TRIPS, the TRIPS flexibility could put medication for us, the generics. We were on the streets to make sure that our parliamentarians domesticated that component of the trade law so that we would have generics in the country, so that we'll be able to bypass patents. If we bypassed patents, so what are these barriers that the government is erecting so that we cannot have access to medication on taxes? For me, I don't want that politics. They can play their politics. But I want that woman in Turkana to have access to her medicine. You know the terrain in Turkana. I want that woman in Tana River who has burnt charcoal, sold it, jumped on a border, crossed the Tana River with the crocodiles, gotten onto another border to go to get her ARVs, to get what she needs. Trevor, people are suffering. So the government should take its responsibility. We will not have laws that are sitting somewhere in offices and people are not using them. They should be able to implement that. So as Baridia said, people now have cars just because of BBI. What about our health? Who is going to be voting for them if we are all dead? We have rights, and we want this government to protect our rights. We want this government to protect our health. It is their responsibility to do that.
Okay.
Yeah.
But Patricia, do you see where they're also coming from? Because I see here they're saying that the government-to-government donations should have been written as that. The consignee should have been the government, because that's where the rubber meets the road, actually. Because they're saying here it wasn't declared the way it was supposed to be declared. It was declared by a private entity and not government to government. That's the reason why they have to tax.
Trevor, If today you came to me and told me you had a problem, and I went round to make sure that I sorted you out, does it matter how I sort you out? The Americans would not have brought those donations if somebody did not tell them they had a problem. If we didn't have a crisis, would PEPFAR go out of its way to get us donations? So for me, how they sort themselves out is not the issue. The issue is the government should not put barriers for us. They should not tamper around with our health. They shouldn't. Our health is assured under the Constitution, and they should not put those barriers about taxes. You ask a partner for support, the partner supports you, and now you go out of your way to ask that partner to pay you taxes again. Did we vote for Joe Biden? Did we vote for the Americans? We voted for this government. Let them take responsibility.
Okay. All right, we have to take a quick break here. When we come back, we'll take closing remarks from my guests and find out what next now from this position. We'd like to hear your views as well. I see there's Engineer Lazaro who says the world should reduce expenditure on deadly weapons and large armies to concentrate on emerging unseen enemies and pandemics. WHO should be well funded to stock ARVs and malaria drugs and polio vaccine of the coronavirus as vaccine as well. All right, keep your views coming. We'll be back. All right, thank you so much for staying with Daybreak. Dr. Samuel Kinyanjui, Country Director, AIDS Health Foundation, is still here. Patricia Acero, HIV advocate, is still here. And Bernard Baridi, National HIV Youth Prevention Ambassador, is still with us. And Dr. Kinyanjui, you wanted to jump in on the issue of local barriers that are now being created around.
Exactly.
Yeah.
I thought Patricia was very explicit in how she explained that when we started accessing ARVs,
Yeah.
the early years of year 2000, the greatest barrier to access of ARVs in the entire world were patents that multinational companies were holding. Patents that would have lasted 20 years before people in the third world would have accessed ARVs. But advocates and the world saw sense in setting aside the patents and allowing the generics to save lives. So if the international community and if the country Kenya could adopt such rules to set away patents, how is it so difficult now to just comply, change the consignee, which is a letter that should be sent from where the drugs came to the country? How is that such a big issue that it can forestall? It can lead to such a crisis. Why is it taking 3 months, almost 3 months now, to just change the consignee? I think there is more than this change of consignee. And that's what I think Patricia is calling politics,
Yeah.
which should not come here.
Okay.
They should be played at a different level. In healthcare, we shouldn't be having politics. So I believe this is something that even the Minister for Finance can waive. It is his responsibility. The law gives him ability and authority to waive, even when the drugs are imported by a private individual, private company, leave alone an NGO, which is non-governmental, non-profit making. So this should not be a barrier. I think this is a smoke screen.
Yeah.
And Trevor, we are not talking about ARV shortage alone. We have challenges with the TB test kit, what we call the Gene Expert cartridges. We are going to be having major problems because we cannot test TB in this country. And TB is also another killer, and a major killer, the leading killer of people living with the HIV infection.
Yeah.
If we cannot handle, people don't have ARVs, we cannot test TB, we can't put people on treatment for TB in good time, we are looking at a major crisis, maybe bigger than COVID.
Yeah.
In addition to this, testing for HIV in young children, what we call early infant diagnosis. Also the reagents for that is in the same consignment. And as a result, young children, infants, and you know a child with the HIV infection, if it's not put on treatment early, they are unlikely to see their 5th birthday. So what we are asking for here is bigger than just ARVs. It is, we are looking at a health crisis, maybe even a health scandal.
Yeah.
And I think we need to raise the tempo to that, sort about the issue of consignment, and leave handling the paper issue behind. I do not think there is a rule that does not have an exception. And this is the time for the Minister of Finance, the Minister of Health, to use this authority that has been given in the law to save the lives of millions of Kenyans.
Okay. And Dr. from the latest research that you've done, how are the infection rates looking right now? What is the position? What is the percentage? Who is the most likely affected right now as we speak?
I think they are still very vulnerable groups. The mothers transmitting the HIV to the unborn on the young children is a group to watch. Young people, because of the nature of our biology, we are young, we are going to be adventurous. But interestingly is the biggest number in sheer numbers, it is in the 40s. People within the late 30s and 40s all the way to 50s is surprisingly the biggest number in terms of sheer numbers of people who are getting infected. And I believe maybe it's the issue of house B and C that are contributing to this. Of course, there still remains a very vulnerable groups, the MSM and injecting people who inject drugs and so on. But it's interesting that we have very young people who innocently may get infected because of inaction by us, even when we have the technology to prevent children getting infected. And we have an able leader in the name of Her Excellency, the First Lady of the Republic of Kenya, Madam Margaret Kenyatta. She has, through Beyond Zero platform, we should be having children getting infected. We have a platform, we have the technology, we have an able leader. The next thing is the young people needs the condoms. Sex is going to happen, whether you or me or anybody else says anything about it. And the best way forward is to make it safe for our young people. Condom is one of the products that are heavily taxed in this country. Besides the ARV, as soon as this ARV issue is settled, the next one on shortage will most likely be condoms. Because of the taxation again? Because of the taxation. And this has implication not only for the young people, even these people in their 40s, they need the condoms. Okay. Yes. But do you find it strange that the highest rate of infection now is in the late 30s towards 40s? Is this because of the mpango wa kando, or is it that the youth are now much more sensitized?
I think for that age between 30 and 40, as Doka said, there's a research we are doing, talking to the Uber guys around 12 to 1 to 2, where do you take people? And I can tell you most of the lodgings in the city are full. You cannot get some of the lodgings. That one, it's called romantic office, something like that. So that one is something that added to that age, because most of them are now working and they have their Pagwakanda and the rest. And then for the young people, we are really done a lot, especially that's why, in fact, it was the leading. So that's why we started things of campus tours, going to discuss with young people. We test them. After testing, we tell them about their sexual pattern, how they're supposed to be preventing HIV and everything. So that one really put a lot of also advocacy that is happening each and every time, social media, in IG and everywhere. So young people that are really at the university now becoming more careful about their status. As Dr. said, the problem again now we are going to get, and I know these early pregnancies that you have seen coming up since COVID started last year. Up to now, you have seen how Baringo sometimes leads. You see how Kilifi and other counties. So this tells you that when you get a large people that there's a lot of early pregnancy among adolescents and young girls, but tells you that most of them need not use protection. That's why we reach into this pregnancy. So that will tell you that the infection rate, because also we have young people who are born with HIV in this country, and we have also a huge number of people with HIV. So if you start seeing those cases coming up, so I think in the next 1 year, by this year, end of this year, we'll start, I'm not praying, but we'll start seeing numbers also increasing for the young people getting HIV infection. The other problem is the condom is not there. As Dr. say, condom is again to KEMSA, so it's take process for you even to get condom from KEMSA. Because I have condoms, I have like right now only 500 condoms in my office, but you find that everybody needs those condoms different. It's even Daktari at the offices. So you find that we need also to start campaign of condom distribution, especially even here in Citizen. When you go to toilet, you get a dispensary of condom.
Yeah.
When you go to Duma Center, you get a dispensary of condom dispensary. The problem was the package, because most of people do not love the sure package. So those are the things that also education. If the young people, it's easier to educate them when they are at school, but at home it's becoming difficult. And right now, during COVID, we are planning how we can go to see them in the community so that we can reduce this new infection. So I think we really need to do a lot of focus, especially onto the prevention. Also, prevention method as abstinence is another thing, where we need also to discuss with our young girls and men that it's not a must that you will not get certificate if you're not, if you have sex. There's no certificate you'll have because you're having sex. Yeah. So also you need to tell them that also they need to stay well. The same way also to add our pastors and religious leaders to support us, create this awareness on behavior change, to make sure that we reduce the HIV infection as soon as possible. Because as the president say, one life goes, or one life means many to one life lose means many to a lot to many. Yeah. Those are the things that we really need to put. And also, as the country says, so also I'm in the Beyond Zero campaign, also helping Mama Margaret Kenyatta on to look at issues we need to put to specific on the prevention for the people. Again, young people living with HIV, also young people who are born with HIV, they also still getting pregnant when they are young, and also giving birth. That's why also we are getting cases of also adolescent young kids young babies being born with HIV. Yeah. So we need to put a prevention measures. The only problem that we have felt, Trevor, is the community. And that especially before I give you it's the community. The community, we don't have parents that talk to their young people about the sexual, about the, when we are growing young up, you are told this is what you need to do. At the moment, we don't have it. So you get that parents are too busy working, they need to get money and do everything, and then we need to really come back and start educating our young people, especially also the older generation. Yeah. Yeah.
Okay. Patricia, are you seeing a gap in information, especially for new infections, the youth and even the older generation? Because there seems to be an idea here that people understand that now you can live happily with HIV, therefore they don't take care of themselves.
There's inconsistency in information. And I just came back a few days ago from Homa Bay. And as Baridia said, we went to a village in Kaboch where we found a lot of adolescent girls, class 5, 6, 7, 8, Form 1, who had given birth to children. And there was a lot of information that is lacking, one, on sexual reproductive health. Yeah. Because HIV is also about sexual reproductive health. There's a lot of information that is lacking, especially for the young people. But we also find that the culture and also issues around morality play a lot. We still need to do a lot of community dialogues, transgenerational dialogues to make some clarities on different issues. Yeah. But one thing that is lacking down there is that we are not promoting and protecting the rights of young people. We are not doing that. As much as we say we have laws in place, if people are arrested, they will be taken to prison. But the process of getting somebody to prison is so long. That is why you hear that some guys have been killed, what has happened. But there's an information gap that we have. And then the parents, because of the economic hard times, the parents have become helicopter parents. We are not there for the children. And our community structure is not also working well. Because initially we used to have grandmothers and the children would be talking to them, but nowadays that is not happening. So there's a lot of information gap, and we assume that everybody knows. So the information that we used to give out there is no longer out there. Right now everybody knows about COVID, and we are Googling about COVID. If only people can get that level of information again about HIV and about sexual reproductive health. When we are talking about sexual reproductive health and rights information, we are not talking about sex. We are talking about the whole person, so that they get to have the information that will be able to help them protect themselves. Yeah. Yeah.
Okay. Dr. How can we repackage this conversation that we're talking about? And Patricia has brought it out very well, that there seems to be a lot of information available for COVID, but now information around HIV seems to be dwindling. Or people are just becoming careless, so to speak, because they believe you can live with it for a very long time.
Thank you very much. That is a very important question and something I've been thinking about for some time. One of the things that in healthcare we don't do well is we do not know how to communicate. Most of the time, each time a doctor is called to the stage, what do you expect? Threats, fear, deaths. We are always intimidating, threatening the community instead of providing them information that is useful to them, that can empower the people to take decision and take action that are useful at individual and at family level. So the first thing that we need to do as a health industry is change our communication style from threat, intimidation, fear. What are you even doing with COVID? We are using police to threaten people and beat people. If the mask is good for me, why would I not want to take it, to put it on? But if I'm beaten to put it on, it's human nature to rebel. Tomorrow I'll throw it away. And we all know that threats and fear only work in a short time. In the long term, people throw it away. And that's why even for HIV, the people attending to, the information is going down. The other thing is that there is this tendency to only focus on COVID, over-focus on COVID at the expense of all the other important issues in healthcare. Recently, if you go into the literature, you clearly see that what is killing our people right now, even right now, COVID is contributing, but it's not the leading. There are much more other things that are killing our people. Pneumonia is still killing our people. TB is still killing our people. HIV is still killing our people. And particularly when HIV and TB combine, they're killing a lot of our people. So we need to make sure that we do not overshadow. I wish the health ministry would devote every week or every month in one press briefing to just list the top 10 causes of morbidity, maybe just the top 5 causes of morbidity, of illness, and the top causes of death for the month. That data they have. They just put them out so that people know where the issues are. This way, we will stop being skewed and having a communication that is unbalanced. And this would empower the people to make decisions. Finally, I would like to say this about healthcare. I think the days of the doctor being the king or the actor on stage, the paternalistic health system, where the health system gives directive and everybody else follows, are long over. It is the time now that the health system, the doctor and the healthcare workers become partners with the community to guide them along. Because the decisions that the community is supposed to make, they should be good, the decisions that are good for the community, not the directives and dictates of the health system. I don't believe they have the monopoly of all the information right now with the decentralized information age where we are in. Yeah. It is important we become partners. This issue of threats, of trading fear, the way we communicated about COVID has caused a lot of stigma. In fact, it has caused more damage maybe than help, because even people fear going to be tested. I even have staff who take several days, even when they are symptomatic before they go to seek treatment. They were healthcare workers because of the stigma. Why? The stigma does not come because the information they got. It's because of the threat and the fear that we are spewing every single day. Yeah. So that's my take on that subject.
Okay. Before I start taking closing remarks from all of you, Baridi, you know, as the National HIV Youth Prevention Ambassador, what is that one central message that you'd like to get to the people out there that you think is not forthcoming? And also, what is the plan henceforth to ensure that there's a bit of sensitization on HIV matters?
Okay, the problem and the challenge we have as a country that we need a lot of communication, especially we need to have Kenya need to have a health talk show where government or partner needs to put money to fund to have a health talk show where people can be able to discuss what we are discussing, even if it's weekly, even if it's 1 day per week, so that it will be able to create awareness on behavior change. Because of the problem you're having, a new infection is coming directly from the young people after high school, direct when they go to the campus, the freshers and everything. That's where now new infection you start experiencing when you go to test people. That also tells you that most of the people also right now, especially young people, they use condom, but not all use condom. So you know the condom and the issues that are coming with the stigma also, not even the stigma alone. We really need to advocate on how prevention measures can be taken, which is combined prevention measures to be taken. So Kenya really need to have a advocacy, especially for a health talk show where we can get the discussion with each and every person. We need also to make sure that we have a community-led groups, like if you go to the market center, we have youth groups that can act, create awareness on behavior change, on sexual and everything that is happening to their lives. Also, the last thing that also we need to make sure that each and every parent in the rural areas, the mama mboga, everybody understand how to have a discussion with their kids. The church also play a very good role, that we need the religious leaders to come out to start educating people. No such a HIV as a demon the way it was, or the way they always look at it, but they look at HIV as any virus that can take anyone, or even some of their members can be HIV positive. And then now we need also to go back to school. Trevor, I'll tell you that most of our schools, I don't know right now, but life skill lessons, you'll find that maths teacher will come and teach in those life skill lessons. Let the life skill lessons be life skill lessons. Let we educate, let the teachers also start discussing sexual issues with the adolescent and young people in schools. Okay.
And let me bring back Patricia on this. Patricia, should the messaging be crafted differently? You mentioned you were in Homa Bay the other day. Should the way we speak to people of Homa Bay be different from the people in Nairobi, for example? Because the issues they're facing, they are very different. You find that there's still some women who maybe have lost their husbands, and sometimes there's this issue we call of wife inheritance. And then there's the issue in Nairobi where sometimes it's just basic economics. They simply live hand to mouth. Should the messaging be different for different people to understand how HIV impacts them differently?
Trevor, you are very right. And that should also look at the trends of HIV. As much as there's been a lot of work that has been done, like along the lake, that is Nyanza, we still have those high levels of HIV. It's because we have a uniform kind of information. We have the ABC. And then a person comes in and with what they think should be the prevention messages, not understanding the culture of the people and how those people live. I think those prevention messaging should be homegrown. And the people within a given region should be involved in part of crafting the specific messages for that specific place. Like you say, the messaging I would give in the messages I would be able to give in Kisumu or Homa Bay or Siaya would not be the very same messages that I would give in Kakamega, where I was born. I'm born in Kakamega. Those are two different messaging, because I know the type of life that these other people lead and the type of life that the fishing community lead are two different sets. So the prevention messages should be completely different, targeting the specific things that are happening within those communities.
Okay. All right, I want to take closing remarks from my guest in studio, but let's see what you're saying online. There's a lot of it coming through. Let's squeeze in a few of them at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. Let's bring them up on the screen. Before I take closing remarks from my guest here, see what you're saying there. I see some of them on my Twitter handle myself. As soon as we have that on the screen, I'll show you. But I see Governor the Dreamer here saying people living with HIV often internalize the stigma they experience and begin to develop a negative self-image. They may fear that they will be discriminated against or judged negatively if their HIV status is revealed. But Patricia, is this still the case? Or have we become a more modern society now?
We still have a few who have self-stigma. Yeah. But most of the stigma still is from the community and institutions. Yes. But self-stigma has really gone down.
Okay.
And the reason why we still have it is because of the strategies that have been taken. We have very great strategies in the community that we use to help people not to have the self-stigma. Yeah. And that is to give them information on what they need to do to counter that.
Yeah.
But you find that we don't have funding to be able to carry all that out.
Yeah.
Yeah.
I ask you this question because you've come out clearly to say that you're a person living with HIV. Before that, was your family a bit resistant? That don't say this, don't come up in public and talk about it?
Trevor, I was tested when stigma was very rampant, and that is 1990. And from the first day I was tested, I came out with it. My family was supportive. My friends went crazy. They didn't want me to talk to anybody about it. They were more stigmatized than myself. So like, don't talk about it, Patricia. This is not true. This is not happening. Something is not right. Don't talk about it. But I kept talking about it. I got the support of my family. I was not stigmatized by my family, but I got stigma later on from the society and from in different institutions. Okay. Yeah.
Baridi, is this still an issue with the youth?
Yes.
Or is it a modern time now?
It's a still issue, especially the youth, especially because why it's a big issue. Once you disclose, when you're HIV positive and you start dating, once you disclose your status, the relationship between you and that person always starts disappearing. The connection is moving, like nobody you'll hear that young person will tell you that they don't want to disclose because when they disclose, they will be stigmatized. So most of the young people who are HIV negative and the young people who are HIV positive, it's very difficult for them to date. And that is why you find that people are still having self-stigma even when they go to the campuses. I have students who are staying in the one hostel, then one of them is HIV positive, and then the stigma that come out from learning institution, the other student had to go and look for another hostel outside where their parents can now pay it. And that is what affecting most, even in the high school, that you cannot keep your medication in your box and take it the evening and morning and the evening. So you have to give it to maybe your nurse, or you give it to a teacher to help you to take them, because the stigma also that comes when you are in high school and when you are in university make you to have that self-stigma. Yeah.
Okay. Dr. How best should we deal with that issue of stigma now? Because you'd think in the 21st century that should disappear, but it seems it's still an issue now.
I would say that a system works exactly as is designed. So when we see stigma, it is what we have been perpetuating. I think while we blame the persons who live with HIV infection for feeling stigmatized, I think it's perpetuated more. I feel it is perpetuated more first by the health system. Because of the way we even segregate them. Even their clinic, we build it far away from everybody else, and so on. And the other thing is the way we treat them. Look at the way COVID patients are being treated right now in the hospital. The first you walk in, some people even want to wash you with sanitizer. They want to spray you and so on. And as a result, the community just looks at what and replicates what is being done by the people they believe are more learned in this area. When the patient walks in to see any doctor, they are open and they are suffering. All they want, they only seek three answers. Number one, doctor, help me to know what's ailing me. That's the diagnosis. Number two, they want to know, now that you know the diagnosis, how can I get better? Treat me. Whether you want to give me medication, whether you want me to take tests, whether you want to do procedures on me, I am ready. That's what patients come to us with. And finally, they would like to know, when it's all done, what can I do to make sure I never get in this situation again? But when the doctor first labels the patient or the client and treat them differently than any other people, then it is natural that the person will feel there's something wrong with me. And they start inwards and blame themselves and isolate themselves. And then the community responds to that. So I think we need to build it from the health system, and the community will respond to how we design the communication, how we deal. For example, right now, one question I keep asking myself, why is it that we still have HIV clinics, even for stable clients, like my colleagues here? Even for stable clients, why do they need to still go to the CCC clinic? Why can't they join the general outpatient specialist clinic we call medical outpatient clinics to be treated together with people who have other chronic conditions like diabetes, like hypertension, like COPD, or renal or kidney problems. Why can't they be on that? They are not infectious. They will not infect you because they were queuing together with them. Why is it that they are kept, they are continue to be isolated even when they are stable? I would understand the ones who are acutely ill or who are recently been started on medication, we want them to stabilize.
Yeah.
We want to treat them specially, give them what will become like an affirmative action.
Okay.
But the rest, I think they should join the others. And I think this can contribute a lot to really demystifying this issue of HIV infection.
Okay. Before I take the remarks coming through on Twitter, I want to have some breaking news coming through to our newsrooms now. Kiambaa Member of Parliament Paul Koinange has died. The legislator succumbed to COVID-19 related complications at a Nairobi hospital. This is information we're just getting right now, that the Kiambaa Member of Parliament Paul Koinange has died. The legislator passed on due to COVID-19 related complications. The MP also served as the chairperson of the Departmental Committee on Administration and the National Security. He was elected on a Jubilee Party ticket. Koinange had served as a member of National Assembly for Kiambaa since August 2017. On Wednesday, President Uhuru Kenyatta sent a message of condolence to the family and residents of Kiambaa constituency following the death of their Member of Parliament. In his message of comfort, the President said that Kenya has lost one of its dependable leaders whose undivided focus was the unity, stability and progress of the country. This is coming from the head of state earlier on today. We now have information that Kiambaa Member of Parliament Paul Koinange has died due to COVID-19 related complications. This is according to the family. It's information that's coming through to our newsrooms just now. There's a message of condolence from the President, the head of state, who mentioned that he is mourning Koinange as a keen and steadfast supporter of the country's peace agenda through the National Assembly's Departmental Committee on Administration and National Security, where he was the chairperson. The family is just giving this information to all of us here. President Kenyatta is also praying that the family gets fortitude and comfort at this particular point in time. This is information that has just come through to the newsrooms, that the Kiambaa Member of Parliament Paul Koinange has died due to COVID-19 complications. That's according to what the family has just told us. Our condolences goes out to the people of Kiambaa and the family and friends of Honorable Paul Koinange. This is coming at a time when COVID-19 infections are still on the increase, and the medical department, the Ministry of Health, is saying we are not out of the woods yet. We have to ensure we maintain social distance, wear your mask, sanitize and wash your hands as many times as possible, and if possible also get the vaccine. All right, that is information that we're keeping a close eye on. The Member of Parliament I mentioned served as the chairperson for the Departmental Committee on Administration and National Security and has been the Kiambaa member legislator since August 2017. All right, let's take now closing remarks really fast, or let's see what you're saying on Twitter in regards to the conversation we're having here. Let's bring up the feedback before I take closing remarks from my guests here on a conversation that we're having on the missing HIV and AIDS drugs, which are stuck at the port. About 1 billion worth of it is stuck at the port due to a tax row between government and the importer. We see JM Sane says ARVs nowadays, it's like they are basic needs. More people are depending on them for survival. All right, Njenga Wakungu says it's really unfortunate that this can be allowed to take place. Could this be the cartels that always take advantage of innocent Kenyans? We need to see the CS for Health, Mutahi Kagwe, act swiftly to assist the HIV patients. All right, let's see. Oduor Ogola says, let young people lead. Ending AIDS is easy. Let the infected take the leadership, not the doctors.
Exactly.
Okay. You don't leave your name here, but this, I believe, is coming on 22422, which is our SMS line. You say, good morning, I'm a healthcare worker dealing with PLW HIV. I haven't received any supply for ART for the last 3 months, which I've always been receiving every month. I am worried because I'm now going out of stock, especially for HEI. This simply means after 6 months, we shall have many children turning HIV positive because of the lack of preventive ARVs. I am sad, confused, and pained at the same time. Wow. Ronnie says people will die without taking the drugs and government is demanding 92 million as taxes to help its people. All right, Daktari, closing remarks from you. Where do we go now from here?
Where do we go now from here? For me, it's easy. It's that our able CS for the Ministry of Health, Honorable Mutahi Kagwe, has his job cut out for him. It's an easy job he can be able to do. It's just a memo from him, maybe a call first to the finance CS, and the next write an official letter and have it delivered, and the waiver is given today. And because we can just scan the same and send it to the port, we can have the lorry start to roll tomorrow coming to Nairobi, bringing the drugs, and we start the distribution. That's easy. The next thing is that the longer one is that the next thing handle is that we move ahead to review these tax rules if they are, because they become an impediment rather than a help for the people of Kenya. And finally, we also need to look in the long term, what my colleagues are saying. We are considered middle income, a low middle income country. It is time we start taking up the mantle of taking care of ourselves. Okay. These drugs are as important as food for our people. Finally, I think there is one more thing that we have not talked about. We touched about it, but we may need to mention it in detail. It is the intergeneration sex that is causing the infection, the imbalance in HIV transmission. In the mid-40s, mainly with the men and with the very young girls. And that's why you're seeing a lot of teenage pregnancy. It is the middle-aged men and the young girls. And I think this one has many aspects, from transactional sex, because of poverty and other things, and also the issue, it has also criminal element, because girls younger than 18 are minors and cannot give consent. And I think it's time we stopped paying lip services and take action on this. So the communication is clear, but we also need to set examples. Okay. Yes.
Baridi, closing remarks?
First is to tell the young people who are at home right now, the ones from school, to make sure that you prevent yourself not to get new infections. Also at the same time to prevent yourself from pregnancies, because that is what we have been dealing with from the last COVID. And I know this is a long holiday, for 7 weeks holiday, and we really need you to go back to school when you are fine once the school are open. So kindly, if there's peer pressure and anything that can put you to start looking at things a different way, kindly we ask you to take care of yourself, make sure you use all prevention measures, and if you can abstain, kindly abstain, so that we can work together to end HIV infection in the country. The other thing is to advise the government we need government to come out and buy drugs, buy medication for its citizen. And I'm asking the head of state direct, because these 1.5 people voted for him, and he took an oath that he will going to protect their lives. These 1.5 million people need his advice right now, and we really need him to come out very strongly and talk to the Minister of Health, especially the CS and all the ambassadors that are around, to make sure that these drugs can be released from the port as soon as possible before next week, because by next week we'll be able to start demonstration in different counties. That is what I can tell the head of state. Thank you.
Okay. Patricia?
First, I would want to say that the short-term measure is what Dr. has said. We get the waiver for the medications that are held at the port, because I understand it's only 1,000 doses. I mean 1 million doses. And 1 million of us are already on treatment. So that means maybe that is a month's dose. The second one is to remind the leadership of this country that the lives of people living with HIV matter. Our lives matter. It's written that people need to be reminded, so I'm reminding them that the lives of people living with HIV matter. They should stand up to be counted, so that one day they will be saying that there was this crisis and we ended it. So I'm looking at the Parliamentary Health Committee. They've not spoken. We've been on Twitter and they cannot pretend that they've not seen. We are not the first people who are talking about it in the media, like live. We have colleagues who have been also in the media, but nobody is talking about it. We want them to stand up to be counted. That is why they're in parliament. We want them to address this. 1 million people's lives are in the line. We want to see them come out. Last but not the least, in the TRIPS flexibilities that we have within the country, we have the Bola exception, which gives us the flexibility to be able to amass material that when a patent goes offline, then we can be able to produce. But I'm sad that maybe our industries are not able to take that up. The government needs to use the TRIPS flexibilities that we have to make sure that in the long term, we have local production. So that we will not be talking about medication coming from India, medication coming from where. We have a big market in East Africa. What they need to do is to pull together to make sure that we have local production and we will not be seeing this. That is in the long term. And the last is for the Kenya government now to put in money for HIV. They've left our lives in the hands of PEPFAR and the Global Fund. Because the American government puts money in PEPFAR, and the American government also puts money in Global Fund. So it's like the American government is taking care of us better than our own government. The government should stand up and take its responsibility. It is time that they took health care of people living with HIV and Kenyans at large, that they put money in health. Right now, I understand we have 5 point what, Daktari? The budget of health in Kenya? Is it 5.4?
In terms of percentage?
Yeah, it's around 5.4.
Yeah.
So when you have a whole budget and you only put 5.4 for the health of your country, that means your priorities are upside down. Yeah. Can they set their priorities right?
Okay. Thank you so much. Patricia Asero, HIV advocate, Bernard Baridi, National HIV Youth Prevention Ambassador, and Dr. Samuel Kinyanjui, the country director, AIDS Health Foundation. We know now that there's still HIV medication stuck in the port right now because of taxation row. The appeal is that this should be cleared. But before we take a quick break now, let me bring back to your attention some breaking news that is coming through to our newsrooms right now. Kiambaa Member of Parliament Paul Koinange is dead. The legislator succumbed to COVID-19 related complications at a Nairobi hospital. The MP served as the chairperson Departmental Committee on Administration and National Security. He was elected on a Jubilee party. Koinange had served as a member of National Assembly for Kiambaa since August 2017. The president, the head of state, Uhuru Kenyatta, sent a message of condolence to the family and all residents of Kiambaa constituency following the death of their member of parliament. In the message of comfort, the president said that Kenya had lost one of its dependable leaders whose undivided focus was with the unity, stability, and progress of the country. The head of state also mourned Honorable Koinange as a keen and steadfast supporter of the country's peace agenda through the National Assembly's Departmental Committee on Administration and National Security, where he was the chairperson. Of course, here at the Royal Media Services family, our condolences goes out to the family and friends of the Member of Parliament of Kiambaa, Honorable Paul Koinange, who passed on earlier on today. We're taking a quick break here on Daybreak. When we come back, Waiga Mwaura had a conversation with Wiper leader Kalonzo Musyoka on the alliances and the way forward in the political field. That is coming up right after this break.